welcome everyone. Thank you so much for joining today's NeedyMed special topic webinar, Liver Wellness, presented by the American Liver Foundation. My name is Carla. I'm the Director of User Engagement at NeedyMed. And before we get started, I'm going to offer a few tips so you can make the most out of the presentation. First of all, if you do have questions, you can ask them at any time by typing them into that questions section of your GoToWebinar control panel. But no, we will reserve answering questions until the end. So if we don't get to your question, don't worry. We will follow up with you by email. And of course, we will provide the contact information for the American Liver Foundation and NeedyMed as well. Today's webinar is being recorded and will be posted on the NeedyMed's YouTube channel. And you can also find materials we thought you'd be interested in the handout section of your control panel. So let's get started with what is NeedyMed for those of you who are not yet familiar with us. What you're looking at is our mission statement, but simply put, NeedyMed is a national nonprofit that connects people to programs that help them afford their healthcare expenses and provides our users with educational information about those cost-saving programs and diagnoses. And we do all of that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put up a screenshot of the NeedyMeds website, particularly our homepage is what you're looking at, because our website really is the face of our organization, and it also gives me an opportunity to point out just a few things, such as if you are looking for healthcare savings resources, you're going to go ahead and check out that healthcare savings tab, aptly named. To check out other upcoming webinars, you can find those and register for them on the bottom right-hand side of our homepage on the calendar of events. And I mentioned that today's webinar is being recorded and will be available on our YouTube channel, and you can find a link to that on the top right of our homepage with the rest of the social media icons. It's the third one from the left. So with that, let's get into today's presentation and why everybody's here, which is the American Liver Foundation's Liver Wellness Program presented by Dr. Amreen Dinani. So first, let me tell you a little bit about the American Liver Foundation. Their mission is to facilitate, advocate, and promote education, support, and research for the prevention, treatment, and cure of liver disease. And I absolutely recommend taking the time to check out their website, liverfoundation.org, because it is very thoughtfully put together. It has a ton of accurate, up-to-date, and useful information, and importantly, it's really user-friendly and easy to navigate. So I told you just a little bit about the American Liver Foundation, and now I'd like to tell you a little bit about our guest. And when I say a little bit, that's exactly what I mean, because I could absolutely do an entire PowerPoint dedicated to her education, experience, certifications, honors, awards, and accolades. But for now, I'll just introduce you to, again, Dr. Dinani. And she has been previously an assistant professor at the School of Medicine at Dartmouth and New York Presbyterian. She was an associate professor at the School of Medicine at Mount Sinai and is currently an associate professor of medicine in the Division of Gastroenterology in the Department of Medicine, Duke University School of Medicine. Wow, right? So as you can see, that's why we are so grateful to have her taking time out of her busy schedule to share her expertise with the NeedyMeds audience. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Dr. Dinani. And now we can see her on video. And you should be able now, Dr. Dinani, to grab the screen and pull up your PowerPoint. So let me know if you have trouble doing that. In the meantime, I'll try one more time and make sure I'm sending it to the right place. Bear with me. Just bear with me. Okay. bear with me, everybody. I'm having a little trouble finding you logged in here. And Dr. Dennani, are you, there we go, perfection.
Right.
And what I was going to, thank you so much. And what I was going to say to everybody, just a reminder, we usually do just let our presenters complete the presentation before we get to questions, but don't let that don't hesitate submitting questions by typing them into that question section of your GoToWebinar control panel, and we will get to as many of them as we can as possible. And with that, without further ado, I'll go ahead and pass the mic to Dr. Dennani. Enjoy today's presentation. Thanks, everyone.
Hi, everyone. I want to welcome you to the Liver Wellness program through the American Liver Foundation. I'm Dr. Amreen Dennani, and I am delighted to be here to just kind of highlight some of the things that are important about our liver and why we should take care of it, and just some basic information about maybe some myths that are out there, but just to give you some tools when you're worried about your liver. What can you do and what can't you do? Okay. So just kind of an overall on what the liver is. So the liver is, one of the largest solid organs that we have in our body. It weighs about, 3,000 grams, and it really sits kind of in the middle, the center of our abdomen, more towards, and a little bit, we always talk about it underneath the right rib cage, because that's where a bigger portion of the liver sits. It's a dynamic organ because it has so many bodily processes, and it functions in many ways, not just as a filtering system, which is what a lot of people think the liver does, but it's really heavily involved in nutrition, metabolism, how we digest carbohydrates, proteins, fat. It also has a big use in how we build muscle. It also produces a lot of our blood clotting factors, so things that allow us to clot when we bleed, but at the same time also things that make us bleed. So it's a very fine balance between those two systems. And it also is involved in detoxification and also killing of germs and other illnesses that we have. So it's truly a very dynamic organ, and ultimately what happens is, for instance, when you digest food, when you eat food, all that blood kind of has to circulate through the liver, get processed, get detoxified, channeled the right way before it can be delivered to the rest of the body. So really, really vital in terms of what it does. Things to know about liver disease is that there are millions and millions of people, not just globally, but even within the United States, and Americans who are affected by liver disease. Common things and common trends that we are seeing is that viral hepatitis is on the rise. We still have goals to eliminate hepatitis C. Hepatitis B, while it is endemic to certain parts of the world, it is still pretty prevalent in the United States. One of the things that we continue to struggle with is alcohol-related liver disease and non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, which we will talk about in a few minutes, is something that is not just a global problem, but a problem in the United States, affecting at least a third of our population. And all these types of liver diseases can ultimately develop into cirrhosis. So think about cirrhosis as a very scarred down liver, where your liver is not then able to do and function the way it's supposed to. And typically cirrhosis is the risk factor that predisposes someone to develop primary liver cancer, which is what we describe, which we call hepatocellular carcinoma. And hepatocellular carcinoma is on the rise, while most other cancers are on the downtrend. And it is the fifth, it is a fifth leading cause of cancer based on our registries. So when we think about liver disease, you want to think about a healthy liver. So that would be what we describe here as stage 0, which is on the left of the screen. So typically a liver is soft, it's very smooth, it's not nodular in nature, and it looks pretty shiny in appearance. And as you get inflammation, irrespective of the type of insult that you're getting, you start having what we describe as scarring of the liver, or what you may have heard as fibrosis of the liver. And that can accelerate into different stages. So stage 1, where you start seeing the initial damage caused by the inflammation and all the other pathways that are triggered. And then you can progress to stage 2, stage 3. And then when you finally reach to stage 4 is what we typically describe as cirrhosis. So here what you see is a very scarred liver. Now the liver doesn't have a smooth appearance, it has a nodular appearance, it looks deformed. There's also changes in the way blood flows to the liver at this point. So and here you see a gross picture of a cirrhotic liver, which is on the right. So you see here it looks pretty nodular and ill-defined in multiple areas, and this is due to chronic inflammation and scarring over time. So when we think about, liver injury or liver damage, you may have heard the terms such as hepatitis or inflammation. So just to give you some background on terminology, hepatitis in general just means inflammation of the liver. It doesn't necessarily tell you what the inflammation is because of. It just tells you that there's something going on in your liver that is causing inflammation. So that would just be hepatitis. There are multiple blood tests that are routinely actually done when we go for our well visits, when we go see our primary care specialist, or when we go see our endocrine specialist. And here I'm just highlighting some of the tests that we routinely get and what they might represent in terms of the liver. So when we talk about markers of liver inflammation or some form of hepatitis, we have liver tests such as the ALT and the AST, alkaline phosphatase, and the GGT. So the caveats here are that some of these tests can be elevated in other disease processes that are not necessarily related to the liver. So for instance, you can get a high AST in someone who may have muscle injury. So for instance, in marathon runners, it is not uncommon for us to see an elevated AST level. Similarly, you can see an elevated alkaline phosphatase level, which is the ALP, in certain bone diseases. So it's really important when you're looking at some of these blood tests to know what context you're looking at them in. Then that just tells you that there's liver inflammation. It doesn't really tell you how well your liver is functioning. So what I mean by that is you could have liver inflammation going on, for instance, let's just say to a viral hepatitis, but your liver still could be functioning pretty well. And the 3 main ones that we really look at that tell us about liver function are things like albumin, bilirubin, and prothrombin, or what we would typically see as INR on our blood panels. So there is a big difference between when we talk about liver inflammation and whether or not your liver is functioning well. There are multiple imaging modalities that can be used to assess the liver. As healthcare progresses and the way we practice has changed, imaging has become very integral in the way we analyze and how we evaluate our patients. So the most common one that we see is ultrasound. So people get ultrasounds or some form of imaging, abdominal imaging, for another complaint, and they have a finding of abnormalities in the liver, which can suggest that there's something going on in the liver, whether it be inflammation or signs of advanced scarring or cirrhosis. There is a point of care testing called a FibroScan, and these are usually ultrasound-based types of technologies that are usually present in specialty cares, where we can not only assess the liver for scarring, but we're able to determine other things such as liver stiffness and if there's any fat in the liver. Ultimately, at this time, when we talk about, truly looking at what is the cause of liver disease, it is by a liver biopsy. This is where a very small, tiny sample is taken from the liver, and it is looked at under a microscope, and this gives us some idea of what is causing the liver disease, what is the degree of inflammation, what is the degree of scarring in the liver. And we have very dedicated pathologists who are familiar with looking at, liver biopsy specimens. So when we think about common causes of liver disease, when we, in general, one of the things that we hear often and see often is that people will state that they think it's typically related to alcohol. So while alcohol is a very common cause of chronic liver disease, there are many other liver diseases as well. So if you think about it in big buckets, if you think about viruses, the most common ones being hepatitis A, B, and C, there are also a lot of other types of viruses, ones that we don't typically think about, but we should in certain populations, are all causes of hepatitis, and in some cases can lead to cirrhosis. There's a lot of genetic diseases that can be associated with chronic liver disease, such as Wilson's disease, and a lot of pediatric liver diseases, multiple autoimmune diseases as well, such as autoimmune hepatitis. Typically we see that in women. And then there is a whole slew of liver-associated liver injury that can be caused due to excessive alcohol use. Then there's also non-alcoholic fatty liver disease or non-alcoholic steatohepatitis, and this is when you get fat deposition in the liver, which can cause inflammation and scarring. And this is typically a combination of having some form of predisposition in combination with a sedentary lifestyle, poor eating habits, and other metabolic risk factors. Other things to remember that are not necessarily a cause of chronic liver injury is things like medications, drugs, and toxin exposures that can cause liver disease, that we will talk about in the next few minutes. So we get this question a lot, what are the signs and symptoms of liver disease? So the reason why I think most people don't think about liver diseases is because it's a pretty asymptomatic disease. And what I mean by that is it's a disease that typically doesn't make you unwell. And by the time you do feel unwell, you've either had pretty progressive liver disease, or you have a type of liver disease which is probably acute that you may very likely get rid of. So typically liver disease is a disease with no symptoms. And so I think many a times people don't think about the liver or think they're doing any liver damage because they feel fine. Unlike other chronic diseases that we think about, such as diabetes or high blood pressure or arthritis or chronic arthritis, rheumatoid arthritis or osteoarthritis. So when you have more progressive liver disease, things that you may have seen or heard of are discoloration of the skin and the eyes, yellowing of the skin and the eyes, which we typically describe as jaundice. You can get fluid that can accumulate in your belly, which we describe as ascites. As bilirubin increases and certain liver-related diseases, it can result in pruritus, or what we describe as itching of the skin. And with that, you can get dark urine and pale-colored stools. Fatigue is a very common, prevalent complaint in our patients with chronic liver disease. And because the liver is involved with a lot of hormonal production as well, we find that there's also reports of loss of sexual drive or performance, because it actually impacts the androgen pathways, and because of the role that it plays in removing toxin substances. We also see sleep disturbances and very liver-specific related confusion that can be seen in people with more progressive liver disease. I think it might be useful, and I touched on this a little bit earlier in terms of terminology. So again, when we talk about people with liver disease, so hepatitis in general is anything that causes inflammation of the liver. So again, it could be because of a virus. It could also be because of other infections or toxins or other autoimmune diseases. Acute infection is typically as a result of a virus or an infection, a viral etiology typically, where you can feel pretty sick. And usually can last anywhere between 6 weeks to 6 months. And most of the time people feel unwell. Chronic infection is when the infection has now persisted beyond 6 months, and we will see this in some of our viral illnesses, and that's what we will refer to as someone who may have chronic hepatitis B or chronic hepatitis C. An antibody in general, and this is not just liver specific, in general just tells us that there is been some exposure to a virus or whatever the insult is, and now it has created some form of a memory of that insult. An antigen is basically a marker, a marker or blood test that tells us that you have had exposure to something. And what it basically does is this would be the trigger for your body's immune system to kick in to then start developing antibodies. Vaccines, we're all familiar with these, but vaccines basically teach our immune system about different bacteria and viruses, and they help us, our bodies, prepare antibodies in response to bacteria and viruses to protect us from either reinfection or preventing infection in general. So we're going to now switch gears to just talking about some of the more common viral hepatitis, so A, B, and C. So they are all a little bit different in nature. So when we think about hepatitis A, you want to think about exposure to small particles, and it's usually what we describe as fecal oral matter. It usually results in an acute infection, so it doesn't have any chronicity. And typically, if you've been exposed to it once, you don't get infected again. This is something that you can get vaccinated against. Hepatitis B, is different in that it's an exposure to infected body or body fluids. And this is an infection where about 5% of healthy adults will go on to develop chronic infection. Once you have hepatitis B, you either have developed chronicity or you cannot get it again. Again, this is a virus that you can actually be vaccinated for. And then there's hepatitis C. This is, again, a virus that you can be exposed to through infected body or body fluids. And majority of the time, this results in chronicity, which means patients or people will continue to develop an infection with hepatitis C, and usually require treatment to remove the insult or hepatitis C. Once you've been infected with this, once you've been infected with the virus, with hepatitis C, and treated it, you are still at risk for acquiring it again. So you could get re-exposure. And again, this is a virus, hepatitis C, where there is no vaccination available. So hepatitis A and B, things that you can get vaccinated for, which means you can prevent disease. And hepatitis C is something that you cannot be vaccinated for. Hepatitis B and C are typically due to infected body or body fluids, while hepatitis A is usually transmitted through infected fecal matter. So hepatitis A specifically, it's diagnosed through a blood test, and ideally what we tell people to do is rest, hydrate, get lots of good nutrition, and these symptoms don't usually last for more than 8 to 12 weeks. If you are exposed to hepatitis A, or if you hear about an outbreak, you want to try to prevent as much as you can, but you do definitely want to see your clinician within 2 weeks of exposure. Things that you can do proactively to prevent exposure or infection is make sure you're washing your hands with soap and water, being very careful to eat food that's prepared in a sanitary way. During an outbreak, you want to try receive a vaccine, a shot, at least the first dose of hepatitis A vaccine. You don't want to be sharing equipment with people, and using barrier when you're having oral and anal sex. As I reminded you, this is something that can be transmitted, fecal oral transmission. who should be vaccinated? We advocate for vaccination for anyone with any form of chronic liver disease. So, if you are someone who has another liver disease, we strongly advocate that you get vaccinated for hepatitis A in general. There are certain risk factors for this. So, men who have sex with men, people who use or inject drugs. So people who are already exposed, people who already may have a potential to be exposed to viruses. We definitely recommend vaccination in children as well under the age of 1. And also if you are traveling to areas where hepatitis A is prevalent, so international travelers should be vaccinated as well. In terms of hepatitis B, we recently, through guidance from the CDC, are advocating for one-time testing, one-time testing and vaccinating adults at ages of 18 and higher. The way we diagnose this disease is through a multiple blood tests that tell us a little bit about what stage the hepatitis B infection is in. So it's very confusing when you get some of these blood tests because it could be an indicator that you have an acute infection or chronic infection. The big things are when you have exposure to a known exposure to someone with hepatitis D, you have to see your clinician within 24 hours. And the reason for this is that hepatitis B is a very, very contagious virus. For instance, it can sit outside of the body, for instance, on a surface for even up to 10 days. So it's really, really important that if you've had exposure, you want to get some medical advice. And during that time, we do advocate for giving the first dose of the vaccine or shot called HBIG, which can help prevent infection. Things that we can do to prevent it. So get vaccinated, again, good hand hygiene, trying to have barrier protection, especially if you are going to have sexual intercourse with someone who already has hepatitis B. We strongly advocate, and we have guidance as well, that vaccinating at birth, in all children, but also especially in people who have hepatitis B who are giving birth to infants. We advocate for giving HBIG to the infants, but also giving them the first dose of vaccine within the first 12 hours. It has been shown to decrease transmission from mom to baby. So again, vaccination is advocated for, infants, children younger than the age of 19 who are not vaccinated, any high-risk behavior that would predispose you to getting hepatitis B. And again, if you have any form of chronic liver disease, we strongly advocate for hepatitis B vaccination. So here is some of the things that we talked about. So, risk factors, for hepatitis B, but like I said, at this point, we recommend pretty much vaccination for anyone. Here, what we're highlighting here is some of the tests that are available. That tell us a little bit about the status of someone's hepatitis B. So there's a test that you may have heard of called the hepatitis B surface antigen test, which is HBS antigen. And this basically tells you that the antigen is found in the blood and that somebody has hepatitis B. This can be positive in someone with an acute infection and a chronic infection. If you have a negative test for surface antigen, that basically means you do not have hepatitis B. Now, in terms of the antibody testing, there's several antibody tests, but essentially, if you have an antibody against the surface antigen, that tells you that you have either developed immunity to the hepatitis B virus or you have been vaccinated for hepatitis B. The way you make the differentiation between whether or not you've been vaccinated or actually and then mounted, whether you've been vaccinated or you are someone who's been exposed and then has mounted an immune response, is by checking a core antibody test. Basically, when we interpret these tests, there are a few tests that we look at all together to determine the status of someone's hepatitis B. Now, switching gears to hepatitis C. Again, with hepatitis C, it is very common, it's very prevalent, and we do have guidelines and a mission to eliminate hepatitis C by 2030. In terms of who should be screened, we advocate for screening for anyone 18 and older, at least so one time in their life should be screened. There are certain populations, such as people who are in dialysis, people who continue to engage in behavior that puts them at risk for hepatitis C. We advocate for testing annually in that patient population. Things that we can do to prevent it is, don't share equipment or use drugs, using sterile tattoos and piercings. You want to try avoid sharing toothbrushes, razors, and nail clippers, anything that will expose you to infected blood. And the other big thing is to get tested, especially if you are someone who may have recurrent exposure to potential exposure to hepatitis C. In terms of treatment, the treatment for hepatitis C has really changed amazingly and dramatically over the last 10 years. We went from treatment that lasted about a year with a success rate of 40 to 50% to now being able to pretty much treat anyone with hepatitis C in as quickly as 8 to 12 weeks with a success rate of 95% and higher. One of the things that we want to highlight in the graph that you see on the right here is that while hepatitis C was initially regarded a disease of the baby boomers, so people born between 1945 and 65, based on lifestyle and behaviors at that time, over the last several years, we are finding an increasing prevalence of this disease, even in younger individuals, as is depicted in this graph over here. And based on this, we advocate for testing everyone at least one time in their lifetime, irrespective of risk factors. So hepatitis C, again, how do we interpret some of these results? And we get these questions often. If you have an antibody to hepatitis C, that tells you that you've had exposure to the virus. It does not necessarily tell you that you have active or chronic infection. The way to determine that would be then to get a viral load, and that would tell you whether or not you have active infection or not. Basically, having a positive viral load, which means finding hepatitis C virus particles in your blood, tells you that you are infected with the virus, while a negative test will tell you that you do not have hepatitis C, but you could have had exposure if your antibody was positive. Just some things to know, that about 1 in 4 people will clear the virus on their own in the first 6 months. And these are people, they just self-clear. Typically, we find the people that tend to clear the virus on their own get pretty sick from hepatitis C, so they will mount jaundice, fatigue, and have a whole bunch of liver-related symptoms, which is usually a sign that their immune system is working very hard to get rid of the virus. Once you determine that somebody has a positive viral load for hepatitis C, additional testing is required, such as determining the type of hepatitis C you have and understanding a little bit more about how your liver is functioning before you can move forward with treatment. So now switching gears to non-viral causes of liver disease. So just to touch on non-alcoholic fatty liver disease. So as the name alludes to, this is liver disease that is liver disease that excludes alcohol-related liver disease. This is basically defined by accumulation of fat in the liver, more than 5% fat in the liver, and it usually presents in a very asymptomatic fashion, which basically means people feel fine. They don't usually know they have this disease, and like I had mentioned earlier, symptoms develop when you have more progressive disease. It's a bit fuzzy when you use this terminology, because some people could be drinking as well during this time, but by definition, you have to exclude significant alcohol use. It's typically associated, the two biggest risk factors for this disease are people who have obesity and people who have type 2 diabetes, but it can also occur in people with a normal BMI. It can lead to cirrhosis and is thought to be one of the leading causes of cirrhosis and perhaps liver transplantation in the near future. And the most important thing to know is that if you detect it and look for it early, are able to intervene early, it is definitely reversible. So like I mentioned, being overweight or having obesity and type 2 diabetes are your strongest risk factors for developing fatty liver disease. Other things that we think about are features of metabolic syndrome, so people have heart disease and hypertension, people who have elevated cholesterol, especially triglycerides. And then there's certain medications, chronic medications, such as cardiac meds, such as amiodarone, or certain cancer drugs that we use that can also result in fat deposition in the liver, which can result in fatty liver disease. When we think about treating fatty liver disease, you know, at present we don't have any pharmacological agents to treat fatty liver disease, so a lot of our treatment is focused around looking at taking a thorough, detailed medication history, taking a very detailed alcohol history as well, especially in people who have more significant liver disease. We strongly advocate for eliminating alcohol altogether and really spending a lot of time in someone's relationship to food and how they eat and how and why they eat the way they do, and encourage and help patients achieve weight loss goals, because we know weight loss at this point is the only treatment for non-alcoholic fatty liver disease, and we know this is a graded effect where the more weight you lose, the more improvement you will see in your liver, not just from a fat deposition standpoint, but inflammation as well and scarring as well. And essentially you can reverse significant disease. So this is a very busy slide, but it just kind of tells you, you know, how should we eat and how should we be looking at our labels. You know, the gist of it really is, you know, when I look at labels or when I tell people how to look at labels, I actually don't tell people to focus as much on the calories, but I actually tell people to try focus on two big things. So look at your sugar content. And when you're looking at the sugar content, you want to see how much of that is added sugar. So we do know that added sugar, specifically high fructose corn syrup, sugar sweetened beverages, which is you know, which is very integral to the Western diet, are all detrimental to liver health. So really trying to minimize the amount of added sugar or processed sugar that we take in. When you look at the fats, it's not even so much looking at the total fat, but it's actually looking to see what the ratio is between the unsaturated fat and the saturated fat. So you want to have more unsaturated fat than saturated fat. And then always, you know, looking to see how much protein is in a meal and how much fiber is in a meal, because remember, it's protein and fiber that keeps you full. And of course, getting lots of minerals and vitamins helps with metabolism, detoxification, and helps minimize inflammation. I use this concept of a my plate very often with my patients, where I basically say, you know, think about splitting a plate in four, where basically half of it is vegetables and fruits and the other half is proteins and grains, and really just doing this exercise pretty much every time you see someone with fatty liver disease. And the big thing is also then to set realistic food options, but also weight loss goals. Alcohol-related liver disease, like I alluded to earlier, is a disease that can present with as just fat in the liver. It can present as inflammation in the liver, so you may have heard of the terms alcoholic hepatitis. It can also give you the more severe form of inflammation, which is what we describe as alcoholic steatohepatitis, and then that too can present as cirrhosis putting at risk of liver cancer. So there's multiple definitions and words that you see that are used to describe people who drink alcohol. So there's binge drinking, there's heavy drinking. Binge drinking is essentially 5 or more drinks in men, or 4 more drinks in women. And heavy drinking is 15 drinks or more, or 8 drinks or more in women. It's very important to know that 9 out of 10 excessive drinkers are usually not dependent on alcohol. So what we're trying to really tell you here is that you don't have to be someone who is dependent on alcohol or a binge drinker to develop liver disease. You can from just having chronic use of alcohol. The other caveat here is that if you think about liver health, if you have one insult, so for instance, if you already have a viral hepatitis and now you have alcohol on top of that, you now have two things going on in the liver that could accelerate your liver disease. So you could develop advanced scarring a lot faster, or you could develop cirrhosis a lot faster, because now you don't have one liver injury, you now have 2 liver injuries. The other thing that compounds that even further if you have a history of smoking. So we strongly advocate for smoking cessation and empowering and helping patients decrease and eliminate smoking as well. So when we think about alcohol, it's important to know, when we're talking about it, what type of alcohol are you drinking and how much of it are you drinking? And, having a drink, a bottle of beer is not the same as having a glass of wine. So it's really important when we talk about alcohol, we go into details in terms of what is it that you're drinking, how much of it are you drinking, and how often are you drinking it? And with that, we explore behaviors and food choices around that. Other things that you want to think about is, in combination to alcohol, is there any other use of over-the-counter medications or prescription medications that could be interacting with the effects of alcohol in the liver, but could also be contributing to accelerated liver disease? And again, smoking is something that we want to address in pretty much everyone who is at risk for liver disease. Drug-induced liver injury is pretty scary when you just look at it on the internet. But one of the things that's really important to know is that Tylenol, and we're all going to talk about that a little bit later, Tylenol is the #1 cause of drug-induced liver injury in the Western world, at least in the United States, followed by a whole bunch of other drugs or substances that we use. This could be a result of prescription medications. It could also be a result of over-the-counter medications. And one of the things that we really caution people on is the use of supplements. So remember, supplements are what we describe as functional medications, which means they're not really regulated in terms of what's in them. There are some advantages to taking certain supplements or vitamins or minerals, but it's not so much supplement that we worry about. It's really the fillers or what else is put in that supplement to give it a shelf life or to preserve it that are typically the cause of drug-induced liver injury. There are lots of medications too that we want to be cautious of that can result in liver-related liver injury, and this is when you have a discussion with your clinician about the risk and benefits of being on a medication in the context of what may be going on overall with your liver. So just a word here on acetaminophen or Tylenol and the liver. So acetaminophen is a chemical compound that we typically use for pain relief or to reduce fever, and it is found in a whole bunch of prescription medications and over-the-counter medications. And it can be the form of pills, syrups, or drops, and like I said, it is the most common cause of drug-induced liver injury. It can be very highly toxic to the liver, especially in people who already have underlying liver disease or cirrhosis, so it's really important that we counsel people on how to take it. One of the common things that I get is like, if that's the case, should I use something, should I use Advil versus Tylenol? We still tell people with advanced liver injury to use Tylenol, but we caution the amount of Tylenol that people can take. So without liver disease, we tell people they can take up to 4 grams or 4,000 milligrams of Tylenol daily. And people who have chronic liver disease, we tell them to limit it to 2,000 grams. So, depending on which formulation you're using, which is 325 milligram tablets or 500 milligram tablets, you just have to make sure it doesn't exceed more than 2,000 milligrams. Lastly, we've talked about some of the more common liver diseases. We talked about viral hepatitis, non-alcoholic fatty liver disease, and alcohol-related liver disease, but there's a whole bunch of other liver diseases that you may have heard of. So autoimmune hepatitis, this is a disease that's more common in women. So just think about more immune-related diseases just being more common in women. Again, there's inflammation that occurs in the liver, usually immune-mediated, which can cause fibrosis or scarring, which can result in cirrhosis. This biliary atresia, this is usually seen in infants. We don't usually see it as often in the adult world, but we do see long-term complications associated. We do sometimes see long-term complications associated with disease. Hemochromatosis is the most common type of hereditary liver disease, which is as a result of genetic mutation involved in iron metabolism or iron control in our body. And then we have these bile duct diseases, which are also immune-mediated, which is primary biliary cholangitis and primary sclerosing cholangitis, less common than some of the other ones that we typically see. With primary biliary cholangitis, the one in blue, for instance, we do have some very effective treatments that can prevent progression of disease and overall healthcare outcomes. And that's it. That brings me to our last slide. Thank you for listening, and I'm happy to take any questions.
Dr. Dhanani, thank you so much for taking time out of your day to share your expertise with the Needy Meds audience. I can see everybody's agreeing with me in how informative and, importantly, easy to understand your presentation was. I think one of the things that happens is a topic like, for me at least, understanding the liver can feel a little bit overwhelming because it's a huge topic and something that feels like difficult to get our head around. But I think you and also the American Liver Foundation can make it easy to understand and drive home why a topic such as liver wellness for everyone is super important, so that we understand the roles, all of the roles that the liver does play. So thank you so much. And as I said, I know that people are agreeing with me because I'm looking at the comments we're getting in, and we are getting in a bunch of questions. So thank you so much for those of you that are participating. And you guys should be able to see my screen now. Is that correct? Are you looking at my screen, Dr. Dhanani? It's a picture of you.
Yeah.
Perfect. Yes. So I do want to remind everybody, you can ask questions by typing them into that questions section of your GoToWebinar control panel. And as I said, we do have a bunch that came in. And before we get to those, I do want to remind everybody that Needy Meds is here as a source of support, whether you need information such that may be related to a specific diagnosis, or you are looking for help saving on or affording your healthcare expenses. We do hope you check out our website, needymeds.org, or join us for future overview webinars. We usually do about one a month. What you're looking at on your screen right now are a list of all of the healthcare savings resources you will get under, again, that aptly named Healthcare Savings tab. If you don't normally have access to the internet or would just rather speak with a person, don't hesitate to reach out to our call center counselor. And again, I will have our 800 toll-free number up on the screen at the end of the presentation. And there it is, right there at the bottom. A reminder, I'm not sure if this is a reminder or the first time I've said it. Our call center is open 9 a.m. to 5 p.m. Eastern time because we are on, excuse me, we are located in Massachusetts. And we also have Spanish-speaking counselors. So with that, I'm going to leave the contact information for the Liver Foundation also right on your screen. And Dr. Donati, we'll get to those questions coming in. And here's
Sure.
one that I'm sure you've gotten before, and I'm sure people have called the American Liver Foundation to ask this as well. And that is, as a person with liver disease, should I have concerns about the COVID vaccine or getting boosted?
Great question. So we get that a lot. You know, as as a liver specialist, and we have society guidelines where we have a lot of guidance on what we should do for people who have chronic liver disease in the COVID era that we currently live in. So having liver disease, as I'd mentioned to you, it plays a significant role in your immune function. So we typically think of our patients with chronic liver disease as being immune compromised. So we strongly advocate for people to take COVID-19 vaccination to protect them. And it's not so much to just protect them in terms of just the infection itself. It's because they have chronic liver disease and they could be immune compromised, not just as a result of the liver disease, but because of maybe some of the medications that they're taking. We want to be able to mitigate or decrease their risk of having really bad COVID infection, requiring hospitalization or intubation or bad outcomes. So yes, we do advocate for COVID vaccination in our patient population who have chronic liver disease. Just a caveat, there may be reports of, mild elevation of liver tests after someone has been vaccinated for, COVID-19. What we've typically seen, or what I've typically seen, is that while we may see a blip up of your liver enzymes, which may be an indication of your immune system really working hard during that time of a vaccination, those liver tests typically go back down to normal.
Thank you so much for the thorough answer, Dr. Donati, and thank you to our audience member for asking it, because I encourage questions so much, and our presenters always do, because we all agree that if one person in the audience is thinking it, I'm sure there are others thinking it as well. So another question that came in, it's a comment followed by a question. This audience member is sharing that she was diagnosed with fatty liver disease, the non-alcohol kind. Her doctor didn't give her a prescription or any medication. The doctor just said to watch what she eats. Is that right?
So I'll try to give you the short version, a short answer to that very, very complex question. So it's not an uncommon question that we get. So at present, in terms of fatty liver disease and non-alcoholic fatty liver disease, we don't have any pharmacological agents or prescription medications that we have to treat fatty liver disease directly. The strongest evidence that we do have is advocating for a healthy lifestyle and promoting and encouraging people to lose weight. 5% weight loss is associated with improvement in liver fat. Up to 7% will also improve inflammation, some of those inflammatory features of fatty liver disease and fat. And with 10% especially in certain populations, people with type 2 diabetes, women and being older will also show an improvement in some of those scarring features. While it's very simply said, it's very difficult to achieve. So really working hard with your clinician as a patient and vice versa on how do you achieve that weight loss and how do you empower someone to eat healthy. The big things that I do, I work very closely with patients in this area is we go over food diaries. I strongly advocate for eliminating high fructose corn syrup, processed sugars. I'm a big believer of you need to be able to identify what you're eating, and if you're unable to tell what you're actually eating, you know there's a whole bunch of fillers in there, so trying to avoid that. Strong encouragement to eliminate alcohol, smoking cessation. Now, the other version of this is, so for instance, if you have other diseases, metabolic diseases, in addition to fatty liver disease, the more common ones being obesity, type 2 diabetes, hypertension, high cholesterol, or high triglycerides, we strongly advocate that you work with your primary care physicians and your endocrinologists to treat those things, because treating those medical issues will indirectly improve your liver and fatty liver disease.
Thank you so much. Again, such a thorough answer. And I always say this, and this is a theme that I bring up when we have our partner, the American Liver Foundation, providing any source of educational information and certainly hosting webinars, that taking complicated questions, complicated subjects, and making them easy for us to understand makes it super helpful and makes it actionable. So thank you for that. Another question that I'd love just to get to before we do wrap up today, Dr. Dhanani, is this one actually came in from a couple of people, worded a little bit differently, but basically, my liver blood test showed high numbers for the first time. Is this something I should be worried about?
Okay, so I'm assuming we're talking about liver enzymes. So remember, liver enzymes tells you that there's some form of liver inflammation going on in your liver, but it doesn't really tell you why you have liver inflammation. So when somebody comes to us and tells us that they have elevated liver enzymes, and if it's a one-time elevation, I think the first thing to do is repeat it. The other thing is, remember, because the liver does so much, if you have blood tests drawn during just a viral illness, so a common cold, or if you have a gastroenteritis, your liver test will be slightly elevated during that acute illness. So making sure that you know the context that those blood tests were taken is very important. You also then want to think about, what other things could be impacting these liver tests. We talked about this, right? Are there medications that you're taking? Are there supplements that you're taking? Are you taking these herbal medications that you think are actually good for you, which could actually be harmful to your liver? And alcohol. So those four things you kind of want to go over with your clinician when you're trying to tease out why you may have elevated liver tests. Now, after you've kind of eliminated those things and you've repeated the liver test and they're still elevated, then there's a whole workup for elevated liver tests, and it goes from checking for common things being common, so viral hepatitis, screening for fatty liver disease if you have risk factors for it, if you are, for instance, female with other immune related diseases such as hypothyroid disease or have a strong family history of it, you want to start thinking about autoimmune liver diseases. But the first step really would be make sure it's not an error, repeat it, and then go through really medications, herbs, supplements, alcohol. Did I take them during a time of viral illness before you start chasing just the number?
So important. Thank you so much. And I feel like that was the perfect question and answer to wrap up today's presentation. That is all the time we've allotted for the questions portion of today's webinar. So again, for those of you that asked questions we didn't get the chance to answer, we will follow up with you by email. But of course, don't wait. If you have questions that are a little bit more urgent, you can check out liverfoundation.org or reach out to one of their counselors at 1-800-GO-LIVER. And I believe the American Liver Foundation has also expanded that toll-free helplines hours. So check that out. If you do have questions about further educational resources or ways to save on your medications or other healthcare expenses, visit needymeds.org, or also reach out to our call center counselors. With that, again, thank you to our audience members for joining and participating in today's presentation, and a huge thank you to Dr. Janani for taking time out of her day to share her expertise with the Needy Meds audience. Thanks so much, everyone, and have a wonderful rest of your day.
Bye, everyone.